I will turn it over to Darryl to get us started. Thank you.
Thanks, Carrie, and I want to thank everyone for joining us today. Obviously, this is a constantly changing situation, and we're here to give you an update on what we are seeing regarding COVID in the community and also in our hospitals. I'll start by saying that the situation has definitely worsened since last week, as you could all imagine, and I'd like to start with showing you a few slides. The first is our public-facing dashboard on COVID. And as you can see, the upper panel shows our number of inpatients in our hospitals with COVID-19. That number is 345. That has increased significantly since last week. And just to remind everyone, in early October, that number was hovering around 35. So a very large uptick. I will also call your attention to our lab testing down below. You can see yesterday we resulted over 3,600 labs and had a 17.6% positivity. And the number that we should all pay attention to is that 18.6% on the right. And that's our rolling average 7-day positivity. We do usually between 3,000 and 4,000 tests a day, and actually one day last week up to 5,000. And that rolling average has continued to creep up. And that is telling us that in our communities, COVID is very much around. With that said, I'd like to show you the next slide that gives you a little more picture of what we've seen from a testing standpoint. So the green-blue line there is the 13 county health department positivity of testing, and superimposed is a gray curve, which is our own internal lab testing. And we do so many tests that drives this number, but needless to say, across the 13 counties that are our primary service area, and this doesn't include our Lakeland service area, which actually has a higher positivity, you can see this keeps going up and thus far hasn't shown much signs of declining. And then my final slide, and this is something you may have seen before, but this is showing you essentially the entire state of Michigan. And you can see that whether it's Southeast Michigan, West Michigan, Northern Michigan, or the UP, we are seeing increases in COVID across the entire state. And the rise of that increase is really increasing rapidly in all settings. And so with that said, I want to give you a little bit more detail about what we're seeing, first of all, from a testing standpoint and some of the changes we've had to make, and then a few other pertinent positives before I move over to Shawn. So first of all, as I mentioned, we're doing between 3,000 and 4,000 tests a day, sometimes up to 5,000. With that said, for two reasons, we've had to curtail some of our testing in the last week. The first is the demand is truly incredible, as you could imagine, seeing all those positive folks in our communities. And we are very concerned that if we don't limit in some way the number of tests, we will have such long waiting times that those tests won't be meaningful. The second is there still remain supply constraints. We're thankful that we have multiple different vendors and multiple different platforms we perform tests on, but there is day-to-day worry about different testing platforms and their supplies, so we have to limit this to some extent. So as we mentioned last week, Spectrum Health has made the decision that we are limiting our testing to symptomatic people in our communities. We are prioritizing them to make sure that we can do the right number of tests in the right time period. The next comment I'll make has to do with capacity and staffing, because we get these questions all the time. The good news, and Shawn will attest to this as well, is that ICUs are very, very busy. If you would have asked us a month ago, how would things go with this many ICU patients, we would have said we're pretty full. The good news, and our teams have truly been spectacular, we have opened additional ICU capacity across our hospitals to the point where while we are very busy in our ICUs, we have additional capacity, and if need be, we can expand capacity more. Our nurses, our doctors have truly been amazing in this regard. From a staffing standpoint, we are doing okay now, but much like the community, we have a lot of staff that have contracted COVID-19 in the community and therefore are calling in sick. With schools now closing, we have staff that sometimes can't make it into work because they have to watch their kids. And given the acuity and the volume of patients, we are stretched and we are monitoring that very closely. Two other points, and I'll turn to Shawn. The next is what we're deferring at this point. So we are deferring surgeries, and only certain surgeries. These are surgeries that require an inpatient stay that we consider elective. This is far less deferrals than we did in the spring. We've learned a lot. We've actually converted many surgeries that historically are an overnight stay to outpatient with the physicians of those patients involved. And at this point, we're deferring about 10% or less of surgeries. This is markedly less deferrals than we did in the spring. And then finally, a point which I'm sure we can talk about again later, but our team is incredibly excited with the news that has come out over the last 2 weeks, both from Pfizer and Moderna on the vaccine. And I will tell you that we've had work groups now in place for over 2 months. These are internal to Spectrum Health and collaborating with every health department in our service area, as well as all of the other hospitals, health systems, physician practices, you name it. So we stand ready and able when a vaccine is available for distribution. Everything from -80 freezers to an entire distribution administration network. We look forward to a vaccine, and we do feel there's a light at the end of the tunnel. And with that, I'd like to turn it over to Shawn Ulreich, our Chief Nursing Executive.
Great, thank you, Darryl, and thanks to you all for helping to send our message to the community. I'd first like to talk about our caregivers. As Darryl mentioned earlier, we have a phenomenal team here providing care to our patients. And they've been doing this since the spring, but certainly this surge is nothing like we've seen in the past. Our patients are incredibly sick. Obviously, Darryl talked about expanding our ICU outside of our traditional ICU. Our patients are sick. This is incredibly stressful for our team members. And so there are things we need when we need help from the community. Certainly with the acuity of our patients that we have, it's draining physically, but also emotionally. We know that our patients are coming into us with heightened anxiety, sometimes fear, and then obviously the physical symptoms that they're having. So we know that our caregivers are working really hard. We need help from the community, and I'd like to talk about some of the things that the community can do to help us. First and foremost, which you've heard repeatedly, is the safe practices, which includes wearing a mask and social distancing and excellent hand washing. Another thing is the gatherings of groups of people. Don't gather indoors with groups, with people outside of the individual household. And if you're outside, still practice the same type of safe practices. We know the holidays are coming upon us, and that will be especially challenging. All of us want to be with family members and have the same traditions that we've had in the past. But this year, we absolutely need to do something different. We're asking the community, please limit gatherings to your own household, your immediate household. By staying home now, we increase the likelihood that we could all be together next year and enjoy the holidays in a much different way. For those people in our community who have had COVID-19 and have recovered, we ask that you consider making a donation of plasma so you can help another member of the community. Our entire community is low on convalescent plasma, and your donation can really help save a number of lives. To learn more about those donations, you can certainly contact Spectrum Health's Office of Research and Education, and we have a website that you can certainly go to for that. I'd also like to talk just a bit about exposure. And so in our community, if you have had exposure to someone who is known to have COVID for more than 15 minutes, and even if you don't have symptoms, you really need to quarantine. And that's important so that we help to stop the spread of the virus going forward. You know, within our hospitals, as you can imagine, we make very difficult decisions around this pandemic every day. And one of the decisions that is never made lightly is the decision about patient visitation. And so we've made the very difficult decision to restrict visitors further last week. This is in line with some of the work that we did earlier in the spring. The majority of our adult patients will not be allowed to have any visitors. There will be exceptions, and certainly in our ICU areas, there's some exceptions, and for end of life, there are exceptions. But we don't make these decisions lightly, but feel it's in the best for our community and caregivers.
Shawn, Shawn, sorry to interrupt. We're having some technical difficulties with your audio. So we're going to work with you to try to correct that. I think you got through almost all your opening remarks, but I think I'm going to turn to the questions while we work with you to get that audio a little bit less muddy as some of the media have shared.
Okay.
There's an issue there. So with that, I will turn to our first question, and maybe if you've got a headset, you could put that on. So we will turn it over to Mark Sanchez from MI Biz to ask the first question.
Hi, good afternoon, everybody. And can you hear me okay?
Yeah.
Coming through. A couple questions on how much did you expand your ICU capacity? What was it before? How much capacity have you added? And where are you getting those the staff to staff that additional capacity? We've heard so much in the last couple of weeks about capacity. Bed capacity is not the issue. Staffing is the issue. So
Right.
what did the ICU go, and where are you getting the staff?
So Mark, this is Darryl. So I don't have the exact number of ICU beds, but I can tell you that we've expanded our internal capacity now by about 30% in the last 2 weeks for ICU. The good news is we have other beds within our hospitals that really can function as ICUs with the proper monitoring equipment, the proper size. And really ICUs require two things, and you just nailed it. Number one is staff, and number two is the right other equipment. And if you went through our hospitals now, you'd find on certain floors that weren't ICUs before, they now have rows of equipment that were never there that we can stock and use for emergent situations. From a staffing standpoint, one of the benefits that we have here on the west side of the state they didn't have in Detroit early on was that we had drills and training and plans for this that we started in February and April, I should say February through April. And at this point, we were able to then pull those plans out, and we have nurses that were on, say, a cardiac unit that were trained to be in the ICU that aren't historically there, that are now working alongside really amazing nurses from our ICUs that are now training them as well while they're all working together. In addition, we've moved physicians, particularly our ICU physicians have been spectacular. We've moved them out of the clinic where they're mostly pulmonology or lung docs, and we brought them into the hospital to staff our ICUs. So we have additional capacity both in staff and in beds. It's just a matter of moving things around. With that said, I don't want to downplay. These patients are very sick, and maybe Shawn might have commented, I couldn't hear her very well either. Sorry, Shawn. But the one thing that I think is very different than what we saw in the first part of this is the people that make it to the hospital, and definitely the people that get admitted to the ICU, are far sicker this go round than the first time, at least here in West Michigan. Some people think that because we have better therapies now, specifically with steroids, remdesivir, the drug you've heard about, a few other cocktails of medications we have, that if you get sick enough and you fail those drugs, that by the time you make it to the ICU, you are very sick. And so walking through our units, it is very hard to see. And when you talk to some of our doctors and nurses, they've never taken care of this many very sick patients at the same time.
All right, thank you. Thank you, Darryl. And we will now turn to WGBU Radio for your question. I think along the similar lines, but if you want to go ahead and ask your question, that'd be great. Okay, well, we will move on to the next question. Let's go to Kristen from the Detroit Free Press. If you're on, if you want to ask your question.
Hi, thank you. I was wondering if you could please detail for us how many staff members are out of work right now because of COVID-19 infections and/or exposures, and how has that affected operations?
Shawn, do you want me to take it, or would you like to take it?
If you want to take it, I can add some commentary.
Oh, sure. So we've been very public with all of our staff and with the general public about our staff positivities from the beginning. We post on the website, and you saw that on my initial slide. And so we have had, since the beginning of the month, probably somewhere north of 700 staff members who have tested positive out of our 31,000 employees for COVID-19. We actually do very vigorous contact tracing internally and find the vast majority, over 60%, know where they caught it. And almost always it's in the community. They went to dinner with a friend who the next day tested positive. We have about 20% of our staff that aren't sure where they got it, and another 20% of our staff that generally believe they might have gotten it at work, and most of those exposures are from other staff. And so we've really gone out of our way. You can imagine hospitals were not meant to be socially distanced, and particularly in break rooms with eating. So we've made massive changes over the last few months to try to minimize that. As far as how that's affecting our operations, thankfully, we have a large team and a very robust team. And so people have taken up the slack and other people have been taking those shifts. And thankfully, just about everybody is doing incredibly well. And a lot of those folks from early in the month are ready back to work. Shawn, anything else to add there?
Yeah, I think the only other thing I would add is certainly for some of the areas, we've required our staff to work extra shifts through the pandemic here. And so that certainly has helped us get through this as well.
Great, thank you. Let's turn to WHTC Peg McNichol, if you would like to ask your question.
Yes, can you hear me?
Yes, we can.
Okay, just checking. So the question I have is, of the beds that you have total, including those that may be in reserve for an ICU, of the total number of beds that you have, what's the percentage of beds taken up by COVID patients?
I'm doing the math in my head right now.
Yeah.
Approximately, at this point, approximately 25% are COVID. And while one might listen to that and say, oh, it's only 25%, I want to remind everyone, we are a very busy health system, and there are a lot of people that have non-COVID related care. Just this weekend alone, on one day, we had 6 strokes admitted the same day. And so between strokes, heart attacks, and all the other sorts of care that's needed, we were, prior to this recent surge, we were upwards of 80 to 90% full already. So this 25% is very significant, particularly as we're trying to take care of all the needs of the community. And then the other thing I'd add to that, as I mentioned earlier, is these people who get admitted tend to be far sicker than your average pneumonia patient, for instance. And so the resources required to care for them, both from staff and everything else, is much more.
You know, Darryl, I would add to that as well, is that our regional hospitals have really stepped up and played a big part in taking care of the community at large. And some of them, as you know, the bed numbers of beds in those hospitals are much less. And some of them have had up to 50% of some of their patients be COVID positive. So they're doing a great job in managing the patients and being able to keep them local.
Thank you for that. Let's head over to David Bosick from Ludington Daily News. David, go ahead and ask your question.
Thank you. Can you hear me?
Yes.
I think I heard earlier there was some donations being sought for plasma for those that are labeled or considered recovered, but I'm wondering what kinds of care and treatment that the system is seeing for those who were confirmed cases from long ago, and what kind of ongoing care are you guys seeing for those now recovered cases?
So the so-called long haulers, as they're now being referred to in the media. And so these are folks that, just as you say, they had COVID, either a severe case or maybe even a not severe case, and now weeks and even months later are having symptoms, most commonly fatigue, but everything from kind of brain fog to abdominal complaints to lightheadedness. We are steadily seeing more of those patients. Not a huge number, but I think not a huge number are seeking care at this point. But absolutely, there are more and more. There's a lot of research out there, but not thus far, nothing really conclusive as to what is causing that and the best way to treat it. Thus far, the best treatments have been supportive, and treatments like convalescent plasma, which we believe may be useful in the acute phase, have not been shown or even studied for the long haul phase.
Great, thank you. Let's turn over to Jay Green from Crane's Detroit Business.
Hi, everybody. I'm wondering if you could give a projection on how many patients you think will be hospitalized and how many will need ICU care by December 1st. The state's projecting hospitalization rates are doubling every couple of weeks. I'm wondering if you're projecting that, or maybe even higher. It sounds like you're getting quite a surge out there.
Yeah, sorry, Shawn, everyone asks the questions that I think that I'm a little closer to than Shawn. So absolutely, and this is a great question. So we do our own internal surge models. And if we look at our surge models for all 16 counties that we cover, currently 345 hospitalized patients, and we predict the most likely number by December 2nd, so 2 weeks from yesterday, would be, and just want to make sure I have the right math here, would be just shy of 600, so just short of doubling where we are. However, we have an upper confidence number, which is what would be more or less the worst case, and that number is just under 1,200. So somewhere between 600 and 1,200, going up from 345 where we are today. I want to remind everyone that all of these estimates are just that, in estimates, and that one of the things we have a little ray of hope for is the weather has been a bit better recently, particularly last week when we started seeing significant surges in COVID cases. And we're hoping that might mitigate some of this rise. And obviously today's a pretty day. We are very worried, as everyone is in the country, about Thanksgiving and how that might drive those numbers further into December, however.
Thank you. Next question. I'm just going to read the one from WGBU Radio since they might be having some trouble with their audio.
Can you hear me now?
Oh, we can hear you now.
Hey, it worked. All right. This is not a question I like to ask, but I am going to ask it. It's rather dark. How many patients or percentage admitted to ICU are discharged, and how many are not, that being deceased?
Shawn, do you want me to take that or you?
So I don't have the numbers for ICU specifically. We just have our total thus far, and the total thus far that we've had since the beginning of the pandemic is 156 patients that have died within our care. So that could have been within the ICU or it could have been outside of the ICU. We do know that patients that are coming into the ICU are much sicker than they were before.
And I could expand just a little bit. So that 150 number that she gave was for our 13 counties and the Lakeland service area, another 3 counties. If we add everything up, we're about 200 patients since the beginning of the pandemic that have passed away under our care. And I just want to give a frame of reference. For a normal flu season, for the entire season, we usually have somewhere between 20 and 35 people die in our hospitals from influenza. So this is a significantly bigger number. And then as Shawn mentioned, while we can't give you an ICU percentage, about 10% of people admitted to one of our hospitals with COVID-19 thus far have succumbed to COVID-19.
Great, thank you. Let's go to Karen Bouffard from Detroit News.
Yes, hi, thanks for doing this. I'm just wondering if you have adequate access to treatments like remdesivir or monoclonal antibody treatments, things that have been shown to have positive results with some patients. Do you have enough?
Yeah, all right, Shawn, I'll take that one too. It's a mixed answer. So remdesivir, the supply has improved over time. And at this point, we feel confident we have, I don't know if enough is ever enough, but we have a good amount of remdesivir. The 3 therapies beyond that, steroids, obviously easy to have. The other ones, convalescent plasma that was mentioned, there's definitely a shortage of convalescent plasma in West Michigan, and that because you require people that have had the disease to donate their plasma. And then as far as the monoclonal antibody is concerned, I'm going to break that into 2. We are involved in a clinical research trial with Regeneron. That's one of the companies that makes this that has not been FDA approved or authorized yet, but we're involved in a trial for that, so we've definitely used it. As far as the Lilly monoclonal antibody that was approved in the last 2 weeks, we have been in talks with the state, and either we've just received it or we'll be receiving some soon. That will likely be in some limited supply for a while as the distribution across the country is just starting.
Thank you.
All right, good. We've got time for about 2 more questions. Let's go to Karen Hopper-Usher from Cadillac News.
Hi, thanks. I was just hoping I could get an update on the Osceola County and Reed City area, since that's where we cover what we cover.
Sure. Shawn, do you have any specific county data in front of you?
I do not have county data.
And we can follow up on that too, Shawn.
Yeah, I don't.
And I'm sorry, the only comment I'd make there is definitely from a percent positive testing, very consistent across all of the counties we're now testing. So close to that 20%, like I said, with the exception of Lakeland service area, which is down by St. Joe's, Benton Harbor, about 23%. And then from a hospitalization standpoint, if I were to think of Reed City and Big Rapids together, because they're at least proximate to one another, a lot of COVID inpatients.
All right, let's head over to Brian McVicker for the last question.
Hi, good afternoon, everyone. Just one item that stuck out to me during last week's media briefing was Tina's comments about being at capacity in a matter of days. So just that is no longer the case, it sounds like, given the remarks that there's more room for additional patients in the ICU. Could you guys talk a little bit about that?
Well, certainly, what we are doing is a couple of things. Number one, we are expanding outside of our ICUs. So some of our beds that we've used for medical patients or surgical patients are being converted to intensive care patients. That's how we're getting some intensive care capacity. The other thing we're doing is holding on certain types of surgeries for now. We certainly don't like to do that. We certainly want to get as many patients treated for their surgical procedures as soon as possible, but we know that that's one of the levers that we have to pull. So that's how we're getting some of that capacity. The other thing that I would say, which is different today than it was last week, is the number of patients who have been waiting to go into long-term care facilities and skilled nursing facilities. We had over 50 patients at one time waiting, and through some work with our care management department and the community at large, we're able to get those patients discharged a bit more quickly, and that too frees up bed. Those are patients that did not need to be in the hospital, but were certainly occupying hospital beds.
Yeah, and I think the quote from Shawn would be, last week we were very near capacity, we found additional capacity.
Mm-hmm.
So I'm gonna just wrap us up with one final thought maybe you each could offer is, how can the community support all of healthcare workers right now as everybody's dealing with higher capacities and working very, very hard during this time? Why don't we start with you and then we'll go to Shawn.
Yeah, I honestly, and Shawn and I and so many others round all the time, you see it on the faces of so many people. People are working so hard. It's a scary time. It's a hard time. People are rallying around and doing this together, and it really feels like a team. But one of the most challenging things, and we hear this so often, is I go out there into the community and people challenge, is COVID real? People, won't wear masks in public. Folks are talking about, a huge Thanksgiving party. And if you go talk to our doctors, nurses, and other staff, they'll say, that just means I'm going to have to work that much harder and see that many more people die a week from now, 2 weeks from now, 3 weeks from now. So our strong feeling is the more we can all get the word out that this is real people taking care of real people, hopefully will impact some folks and they'll change their behaviors only until the vaccine's here and distributed. Shawn, anything more to add there?
The only other thing I would add is that in the spring, the community rallied around healthcare. We saw signs outside our hospitals on our drives home. We saw signs thanking frontline caregivers. Now, really, this is reversed. The front line really is the community, so we need the community's help. I would also say that some people have started resending cards back into the organization. And just this past, actually this morning, a number of our staff, when they left yesterday on their cars, they had cards, and it was from a particular runner who goes by Spectrum Health, the Butterworth campus, and she left cards on all their cars saying, thank you for your work, thank you for your service, you're saving lives. So my other ask is, don't forget about us.
Did we lose her?
No, I think we're good. Very strong messages. And I want to thank the media for joining us this afternoon and asking your questions. We're committed to being transparent through this difficult time. So if you have additional questions that we weren't able to get to this afternoon, please reach out to our media relations team. And I hope everybody has a good afternoon. Thank you.